Is it on? Okay. So today we're going to talk about the technique called thread lift, and we're going to focus on the lower face. So with time, we have the laxity, and our volume shifts. From here, it goes down, and we have this kind of a joweling and pre-joweling happening. It's early. And Jessica, she has very pretty face. She's, pretty. And it started happening in our, like sometimes late 30s, 40s, 50s. So we want to give the little lift and more sharpness to the jaw. So that gives a pretty youthful look. On the upper face, we can do the threads, or we have option of doing filler too. In the lower face, on the medial most area, the filler works really good, but in the outer, you don't want to bulk this area too much. So the threads works pretty good. And the threads, we have two options, Silhouette InstaLift and the Noah threads. The InstaLift are longer, and they have cones, and they're different amount of cones. And the Noah threads have little barbs, and they're tiny one with the smooth and twist too. So with the time, I have combined all of them together, and we call it threadless to give the best results. So it depends person to person, their skin type, how lax their skin is, to put which type of threads and where, and it can be just parallel, V-shaped, and to intertwine the different type of threads. So with Jessica, we're going to put some barbs, and before there, we're going to clean and numb this area, and we're going to show one side.
Dr. Mira, do you need your spotlight?
Oh no, I'm fine. I don't think you can see much with that light when you're filming.
Exactly.
Isn't that fun? I said, isn't that fun?
Not bad.
It's not what you thought, huh?
No.
It's for me.
gonna be like, Miss Jessica, what happened? You look funny.
Yeah.
What happened?
Oh, we got some rest. That's all, kids.
Yeah.
And listen to me. Why go in the bathroom?
I took a really long.
Okay.
No big laughing.
Okay. Till how long do you think that is? Wow.
Week or so.
That's a huge difference.
You see how your
Yeah. Yeah. Straight back, and then all this will go down.
yep.
All the swelling, yeah, that's swollen. Jawline. Look at that jawline. Told you you'd like it.
Great.
Yeah.
Yeah, here like
Yeah, and it
Oh, this
wasn't what
here.
I expected, so it wasn't, you know.
I told you it
was
wasn't
nervous
bad.
for all, you know, very
Yeah.
nervous for no reason.
so it is all because of the blood thinners. Otherwise, it doesn't have much. You know,
You mean
The
this, even the swelling or just the
swelling,
blood
yes,
at all?
and the bruising
Okay.
is because of the blood thinners.
Yeah. Only I could have stopped him. So that is that bruising starting right there? Yeah. Okay, so I'll just ice it
Yes.
and then
Yeah, even ice it gently. Don't press it too hard.
okay, and try to sleep on my
Yeah,
back. Do people have a hard time with that? That's hard to do.
yeah,
But I guess if you kind of feel sore, you'll flip back right over onto your
yeah. We take Tylenol extra stand every 3 hours. You'll be fine. For 24 hours after that, it doesn't matter.
Oh, what
Do you need anything to say?
Well, this for you. Okay.
Just say teachers deserve to look and feel good.
That's right.
Yeah, so and you say our beautiful, beautiful teacher here, and she deserves to look and feel even better, more beautiful.
Yeah. I'll look better when I get my makeup on.
What do you think, Jessica?
I am really happy right now. I'm glad it's over because I was super nervous, but it was not at all what I expected. So there was maybe a little pinch or two, and that was it. So, like you said, the lidocaine was probably the worst part.
So go for it.
Definitely.
Did you feel like we prepared you well enough for it?
Yeah, absolutely. I knew what to do before. I knew what to do, you know, to make sure that I was ready for it. I stopped drinking my glass of red wine 4 or 5 days ago to help with the bruising, to help stop it. And, you know, and you guys told me that it wasn't that painful. I kind of even felt like it was less painful than some filler, actually. And yeah, and, you know, the filler isn't that bad, except one time with Sculptra, once. But and so this was less, I would definitely say that. So I'm anxious to see it when the swelling goes down. Because I'll be honest, my jaw was never this tight. But it's good, I like it. So.
Thank you so much for sharing.